knowledge needs. Nurses rely on an extensive amount of clinical information and specialized knowledge in order to evaluate the processes they've implemented and measured the corresponding outcomes. So we use a ton of clinical information. We get a ton of information flying at us left and right. And we have to be able to evaluate that process and then implement it. And at the same time, you're doing that with 2 other patients, 3 other patients, 7 other patients, or with students, or, with the community. And then on top of it, we have to measure outcomes. We have to be able to prove that what we did was effective. So we rely on our own knowledge, but there's also times that that's not adequate. We have to access more information to provide safe patient care. And we got to find a way to do it that we're getting the correct knowledge, the best knowledge out there to take care of our patients. And the national survey was conducted and found that consulting a peer was the most frequent way that information was obtained, which is great, but we have to make sure that that's accurate knowledge. The amount of information available is vast and expanding exponentially, which makes the healthcare industry the most knowledge-intense environment, constantly changing, and most of that is attributed to the speed of how we are sharing our knowledge. So even just, changing the way that we treat GERD, it changes. We think of things, how things have changed from week to week, or how the JNC7 and JNC8 change so quickly in between, and that's because our knowledge speed has increased. And computer technology and informatics field are assisting healthcare workers in dealing with this information explosion, helping us keep up with the speed and organize ourselves, or else we're just going to be dumped on with a bunch of new knowledge. So we rely on extensive amount of clinical information. I already talked about that. I apologize. Okay, so one challenge that healthcare is currently facing is the vast differences in computer literacy and information management skills that healthcare workers possess. So, okay, great. I'm getting pretty good at the computer. I always have been, but that's because I had computer classes starting in 4th grade. And some of you might say, oh my gosh, since I had them in kindergarten. And when I say computer classes, I was playing Oregon Trail. Then I learned how to use Microsoft in 8th grade. So now kids take coding classes. But I think about my mom, who is great at typing. She's super smart. She's great at organizing files. But when it comes to intuitive programs, she still can't figure it out, right? It's kind of that whole how some of you can sit down and play with a program and figure it out. I taught myself every EMR I used because I was a traveler for a long time. And I jumped from area to area. I never got formal training. And then when I did get formal training, man, I was even better at using that EMR system. When I became a primary care provider, I think I got 1 day on Epic, but I had to be able to use it fluently by the time I got in there. But because, I'm computer literate and have information management skills that maybe someone from an older generation didn't, it wasn't a problem. But so sometimes it's easy to get frustrated with people who aren't computer literate, but it's a matter of helping that transition happen. And so, experts believe that nursing students and practicing nurses should be educated in nursing informatic competencies, and I agree to that. And of course, you should know exactly how to chart on computers. And it's really funny, when I was teaching in nursing school, we still really talked about paper charting and SOAP notes and all that stuff, which is fine. I mean, it's important to an extent. But really, what we need to get it into was the nitty-gritty of informatics, EMR, right? This is an electronic care plan. These are all the little benchmarks that you have to hit when you use an electronic chart. Because guess what? When you graduate, you're going to go work at a big hospital, and they're going to say, do you know how to do the core measures for after a heart attack on the EMR? And they'll say no. And they'll be like, what did you learn in nursing school? And you'll be like, I learned how to write a SOAP note. Great. So that's really important to understand, is bringing it down to the education level. So nursing informatics was established and is an ever-evolving profession that began when computers were introduced into healthcare. Nursing contributes to healthcare informatics, and the scopes and standards of nursing informatics is important to nursing and healthcare as it focuses on representing nursing data, information, and knowledge. And so yeah, medical informatics is great, but we want something specific to nursing because we have our own discipline. The thing about nursing is that we straddle a bunch of worlds while living in the nursing world. So we have to be able to disseminate information in a medical way, but then we also have to go back in turn and do our nursing stuff, and that includes better ways of communicating our information. So the roles that informatic nursing science engage are numerous. So one position that nurses do quite well in the role of project manager, right? So it's a result of the ability to manage multiple complex situations at one time. And it's so funny because they talk about treatment silos, and one of them is they'll say, you've got the doctor, the nurse practitioner, the nurse manager, and then the support staff. And the nurse manager or nurse practitioner is always in charge of that quality and project management. And all the research just shows, because nurses are really good at that, because we're trained at it, right? I'm sure in medical school, if they had a class that's like, this is how you're a project manager to improve quality, then doctors would be good at it too. And so nurses do quite well as project managers because nurses are leaders. And the basis of our care is on organization and looking at the big picture, right? And so that's why we fit so seamlessly in this role of nurse informatics specialist. So specialty education certification. Nurses who choose to specialize in nursing informatics have 2 certificates available to them. So first is through the American Nurses Credentialing Center, the ANCC, and it's an exam that's specific for informatics nurses. You have to be an RN with at least 2 years of experience, you have to have a BSN, and you have to have completed 30 contact hours of continuing education in informatics. So if you're like, okay, I have my BSN, I don't know what I want to do next, I think I want to kind of move out of bedside and help improve quality, getting this certification is really helpful. And talking to your quality improvement and nursing informatics specialist at your facility can help jumpstart that. And the second certification exam is sponsored by HIMSS candidates who successfully pass this exam will carry the designation of Certified Professional in Healthcare Information Management Systems. This is a really cool area because you are not only improving issues with the nursing informatics, but also just in general information management systems in a healthcare system. So helping shape programming, technological advances, and there's quite a career to be made in that specialty. So the informatics nurse specialist participates in informatics organizations that allow informatics nurse specialists to network and share experience with each other, and allows them to bring these new solutions back to their respective organization and improve informatics issues. So I'm not an informatics specialist, but they sent me to basically an informatics conference. I think they thought they needed a provider. But what I learned there is how I can improve my care, direct patient care, by improving our nursing informatics. And it really made me realize how important these technological advances are to providing the same care that we think about when we think, oh, the good old days. So improving technology and efficiency in workflow, because as people get more complex, we can't just go back to the old model. We have to move forward, and part of moving forward is using technology to help us care for other people. So nursing informatics is emerging relative to nursing specialty, and it combines nursing science, information science, and computer science. Informatics practices support nurses to effectively and safely care for their patients, as the information that they need is more readily available. And also the information that patients need more available. And nurses have been actively involved in this field since computers were introduced into healthcare. So with the advent of EMR, EHR, however you want to call it, it's apparent that nurses need to develop its own terminology, and nursing informatics has been instrumental in this process.